Okay, Greg, I think it's important that we update everybody what happened. Okay, we started the first day of the ketamine 3-day infusion on you.
Okay.
And we got a little bit beyond an hour here, and we ran into some serious issues. The first issue we ran into is some breath holding, but you handled that well. When we asked you to stop doing that, you tried real hard, and that was okay. But then what happened is there was a loss of consciousness at one point. No medications were running on you at the time because we had turned it off to change an IV on you. And you became unconscious, and you became completely apneic. You stopped breathing, period. And so that's one thing that happened. This other thing that happened is that on occasion, even when you were breath holding, you were dropping your sats into the 80s. Sometimes I even saw a 70, which is pretty serious, okay? So you have a breathing issue. It shouldn't surprise us because, as you know, you've been flat on your back for a long period of time. And you've got some table meat. We talked about that, you know, some adipose paniculosis, you know, layer fat.
Yeah.
And we know that patients like you do have these kinds of things. So really, to have you done properly in the most safe environment, you have to be in an intensive care unit to do it. So we talked with your parents over here, and we talked with Emily, your fiance, and we talked to your father. And I've contacted Dr. Cantu about that, and we talked about, oh, by the way, I think part of the problem here is my diagnosis. You got a serious problem with sleep apnea. Okay? Now, sometimes when patients with RSD, it's not uncommon for them to lose consciousness when the pain's severe, but usually they'll continue to breathe without any problem, but that's not true in your situation. Which that also tells me if you do go into the ketamine coma for 5 days, getting off the ventilator is going to be problematic. You may be in the intensive care unit longer than the average patient. So that's my prediction here, and I told Dr. Cantu that. Okay? So it's my job to make sure you have a realistic expectation. And sometimes, again, to make the story complete, if you can't get the patient off the ventilator, sometimes you have to do a tracheostomy, which is reversible. That means they put a little hole here in your neck and get you off the ventilator that way. Now, that can be closed up later, but I just want you to know the truth of what you might be confronting here. Now, so that's the tough part. The good news is that through the ketamine coma for 5 days, we're probably going to get you off the narcotics because you're on huge doses, which actually can be causing a lot of your real severe allodynia, that sensitive, painful skin you have down here in your leg, which is very atrophic, dystrophic, and so forth. Okay, so that's one advantage. The other advantage is I expect the allodynia to go down in your legs, which means you can probably get into water. And if you get into water, you can get some of the dead skin removed from your legs, which places you at high risk for infection. If it's a superbug, you could end up having amputation just to save your life. Okay, so we talked about all that before on the previous video. So one of the advantages is to get you off the narcotics with the coma, which I can't do here. Number 2 is to put you in a safe environment so that we don't have to worry about your breathing, you know, during the actual ketamine treatment. And number 3 is to get the pain down in your legs, so that you can get into the water therapy, which is critical to your ultimate rehabilitation. Does all that kind of make sense to you?
Yes, it does.
Okay, all right. Now, let's turn our attention over here to Emily. Emily, can you think of anything else that we might have overlooked here? Any questions you have or anything?
No, I can't think of anything.
How about it, Mom? You have anything?
I think you covered everything.
Did I? Okay, Dad?
No, I think we covered everything.
We did? Okay, very good. You're a good patient. It's just you got a terrible, horrible disease going on here that we got to do something about, okay?
Yes, doctor. Thank you.